I'm Jim Longworth, and welcome to another edition of Forsyth County Connections, coming to you from the Government Center here in downtown Winston-Salem. I hope you'll stay with us throughout the entire program. Lots of great information coming your way on everything from renting facilities at the Parks and Recreation to understanding more about the WIC program and much more. But where we want to start is on the very serious topic of crime and preventing it. And with us right now is my good friend, Sheriff Bobby Kimbrough. Sheriff of Forsyth County, welcome, sir. Good to see you.
Good to see you, my friend.
You recently created something called a Juvenile Investigation and Intervention Team. What is it and what's the mission?
So basically, we short-named the JIT team, Juvenile Investigation Intervention Team. And basically what it is, it's a group of young men thankful that the commissioners voted, supported it, and gave us funding for it, to basically get out into the community, do some intervention, as well as, if necessary, investigation based on the number of incidents that we're having involving all of our juveniles across the city and the county, coupled with the violence that's taking place. We felt necessary that it needed to be something out there that could deal with the uptick in the violence as well as the investigative needs and sort of try to prevent some of it.
Yeah, I want to get to that intervention thing in just a second, but before I forget, just how bad would you say the gang problem is in Forsyth County?
Well, I mean, if you just look at it, just don't take my numbers, take the police department, the SBI numbers, Uniform Crime Report, but right here in Forsyth County, there are approximately 30 active gangs operating.
Good Lord.
Throughout, approximately 600 people involved in it, ranging from 11 years old to upwards of 30 years old. So the range is from the young and to what I will call middle-aged men.
And they've been around ever since before you became sheriff, because you haven't been sheriff that long. And I'm wondering what factors contributed to this kind of a rise in youth violence?
Well, you know, I say that a lot of things are happening here that have never happened before. We have some issues going on that we need to feel as relates to some social issues. You know, you heard me talk about a lot of social issues lead into criminal issues. Talked about, you know, Maslow's, the basic hierarchy of needs, food, clothing, and shelter. And when people can't meet those needs by any means necessary, they meet them.
Now, you mentioned a couple of minutes ago about intervention.
Yes, sir.
Let's talk about that. What do you hope to try to prevent by doing intervention?
Well, most of all, we hope to intervene and hope that we never have another September 1 by intervening, gathering information that we come across with some of the systems that we have in place already. Couple that with an investigative team, couple that with information in real time, having a unit that can go out and deal with it in real time. So for an example, you may be on Snapchat, or you may have seen some of the Snapchats that come in the middle of the night, and there may be a possible threat at a school. You know, well, manpower is needed to deal with that, to track that down, to unpackage that, and then be ready to deal with it, to intervene and investigate it.
How do you think the community is going to be receiving what you're doing with this initiative, and what areas of the community you think can benefit from this the most?
Well, I think the community is going to receive it very well, because a lot of this came out of the cry of the community, the calls that we get asking for assistance. Sheriff, when are you going to help us, even though we live in the city? We pay county taxes.
Right.
And so the cry of the community, the cry of the people, because it is the office of the people, was one of the reasons that we asked for the unit based on the numbers and the statistic and the crime that was happening. So receiving it, I think it's going to be well received.
And then you mentioned too that as we're sitting here, and the folks, just be reminded, we're sitting here in the Commissioner's Auditorium, where they have commissioners meeting, public meetings and planning meetings. And you mentioned the funding that was handed down to help put this program together. Is this have a limited time? Is it a one-year trial, or is it something that's going to go on? 3 years. Are you hopeful?
I'm very hopeful. I'm hopeful. I believe that it's going to be very successful based on previous units that we've put together prior to this that have been successful. So I see no reason this won't be successful, because at the end of the day, the objective is to stop the violence, help our young men and women get on a positive track, intervene, get them some of the things that they need to be successful in this community.
Is there a website, Sheriff, or something where people can find out more information about this?
If you just go to the Forsyth County Sheriff's Office, you know, we're waiting for the numbers to be appropriated and get the PCN numbers so we can get the units up and running. But the unit is not up and running as of yet. we're waiting on the funding and everything to disseminate to where we can go ahead and begin.
You are a great sheriff.
Appreciate
This
your
is the
kind
opinion
word.
part of my show. A great sheriff, a great father.
You're a
great,
kind man. I appreciate you, sir.
So really, you're doing a great job.
Thank you so much.
And I'm going to keep my fingers crossed that we're going to intervene and cut down on this gang violence.
I always enjoy talking with you, sir.
All right.
My friend, take
Thank
care.
you, young man.
Thank you.
We'll be right back after this.
Unlike other health concerns, mental illness is not always easy to see.
DEPR.
Mental illness doesn't show up on a scale.
Bipolar?
Sorting out a mental health concern takes professional diagnosis and treatment.
Anxiety. I thought so.
If you or a loved one has a mental health concern, don't go it alone. For 24-hour free and confidential information and treatment referral, call 1-800-662-HELP. Learn more at samhsa.gov/support.
Back now on Forsyth County Connections. We've talked before about violence and preventing violence and dealing with it in the city and the county area. We want to come at it from a little bit different angle right now with a good friend of ours who's been on the show before, Shontell Robinson's Deputy County Manager for Forsyth County. Welcome back.
Thank you, Jim.
You sent me an email one day and said, let's talk about and explain Cure Violence. That was in quotes, Cure Violence. It's a program that's been created. What's it all about?
So it is a public health model that approaches reducing violence in a totally different way. It uses a public health model to which they do disease control. And so we try to detect and interrupt the violence. We try to work with individuals to change their social norms. And so we use individuals from the community who have lived experience. So they may have been previously incarcerated or previously in gangs to work with individuals who are troubled in the communities that they are from.
So that really makes it different from most anti-violence programs because you're getting people to, I don't want to say infiltrate, but be involved in the community in a different perspective, right?
Absolutely. And so, what this model really does is ensures that it's not a top-down approach to solving violence. It's really using people from the community who know these individuals. They'll be trusted and credible messengers. And so the hope is that they can help them to change their lives, improve their lives in a different way.
Now you'll be trained. Do you actually offer training to citizens to help out with this?
So no, it's not a training program. We will either do an RFP to try to hire a nonprofit to help us administer the program, or we will hire individuals to be public health employees. And so we would have what's called violence interrupters and outreach workers. And so the violence interrupters would be the ones doing a lot of the detecting and identifying of what's going on. And then they would pass individuals on to an outreach worker who would then hopefully help them to make different decisions. So if they need jobs or if they need mental health interventions and substance abuse and those types of things, so they would help them with
So you're coming at it from, again, like you said, it's almost a health model. You're coming at it from a social type model as opposed to law enforcement. Are there specific areas of the county that you think need more help than others in this?
So we have looked at crime data, and in the area here, there seems to be higher crime in what we call Precinct 222. Some of the housing developments that's in that area is like Cleveland Avenue Homes, Piedmont Circle, in Rolling Hills, and some others. And so we do think that'll be the area that will be primarily done for the pilot program, but we are still finalizing that. We're working with the city of Winston-Salem. This is a joint opportunity and venture between both the city and county to really make sure that we are addressing the area in the most need.
Now, how is that partnership working? Because I know you've got, you have Katrina on the one hand with the police department heads up, a great chief, Bobby Kimbrough, the sheriff who's on this program earlier, and they're doing their jobs. How does this sort of complement, work with, enhance the whole spectrum of stopping violence, preventing violence, helping people?
Absolutely. So first and foremost, this is not a law enforcement program. This is a public health model, so it's important for people to understand that. But both law enforcement and the health department, we all want to reduce violence. You want to reduce violence, right? And so this is just using a different approach. Both Chief Thompson and Sheriff Kimbrough are on the steering committee among other community organizations and partners to really try to spearhead this. But it is important to know this is not a law enforcement program.
All right. Now, how can citizens get more information about what you're doing?
So we are in the infancy stages, but to learn more about the Cure Violence model, you can go on www.cvg.org.
cvg.org. Shontell, I appreciate that you have so many responsibilities in the county and perform them all so well and do so much for so many people. And it's a real pleasure to have you back on the show, and hope you'll come back soon.
Thanks for having me, Jim.
All right. We'll be right back after this.
Performing on stage takes mental and physical preparation. But one thing I never thought to prepare for was cervical cancer. 91% of cervical cancers are caused by the human papillomavirus, or HPV. The good news is there are vaccines that can protect you or your children from cancer. I survived my cancer, but you can stop cancer before it starts. Talk to your doctor and go to thinkaboutthelink.org to learn more.
Back now on Forsyth County Connections, and I want to find out all about WIC, what it stands for, who it serves. And to do that, we have an expert in the field. With me now is Mayte Grundseth. She's Nutrition Program Director for Forsyth County's Department of Public Health. Welcome to the program.
Thank you for having me today.
And a fellow UNCG graduate, so we're talking about that off camera.
Yes.
I'm going to give you special treatment because you're, no, that's right.
I love it.
Let's talk about the WIC program. First of all, folks that don't know, what is WIC? What does WIC stand for?
Great question. Well, the actual official name is the Special Supplemental Program for Women, Infant, and Children.
Okay.
But most of the people know it as WIC.
Right. Now, what's the overall mission, would you say?
Well, WIC has several missions, really. It's improve health, provide good nutritious foods for special developmental stages, such as in pregnancy, infancy, and the little babies.
Not to put you on the spot, but I mean, you have a number in your head of how many people you serve in the county. Can you round it off, or about how many people?
Yes, we're currently serving around 9,600 participants in the program. So it's the fourth largest program in the state.
Yeah, getting on toward 10,000.
Yes.
Who is eligible to receive benefits through WIC program?
WIC. There's two criteria to apply for the WIC program. One is income eligibility, and the second is nutritional eligibility. For the nutrition eligibility, we actually hire professionals, nutritionists on staff who base a series of questions on nutrition.
Right.
Any medical condition, such as, let's say, obesity, diabetes, will be a medical risk qualifier. And then also diet-based qualifiers, which are diet low in calcium, diet low in iron, diet high in fat.
And then those health conditions, you say, okay, you have this particular health condition, so you're eligible now.
You are half eligible. You have to be income eligible as well.
So I can't make more than how much money? I mean, let's talk about that.
We go with the poverty scale. So anybody that makes 185% of the poverty level or below qualify for the WIC program. That's an excellent question, because many people believe that don't qualify for the WIC program. And in fact, we have a lot of people that qualify for the program that are actually working.
Sure. It's what we used to sometimes call, people in poverty who are working and they're going without food and medicine sometimes, and they need assistance because of just the times that we live in. And I appreciate you helping to make those times a little easier and better for some of us. Give me an example of some of the benefits and services that you can get.
Sure. The WIC program provides nutritious foods. We provide nutrition counseling. We provide breastfeeding support and referrals, and we provide health referrals and community referrals.
Right. Now, is there an element of trying to prevent health problems? Because you mentioned, as long as you're pretty much at the poverty level, whatever the criteria would be, and you determine to have a health problem. In helping people with that and with the benefits, you're also sort of preventing it from getting worse and other problems, right?
Exactly. We're a preventative program. It all starts with good nutrition. That's why we like to get the pregnant moms into the program as early as possible, because having a healthy pregnancy, you'll have a healthy baby. And having a healthy baby, you have a healthy child.
Now, some folks might be watching this and say, well, wait a minute, this doesn't apply to me. But here's my general question. How does this, what you're doing and who you're helping, how does that benefit and help the whole community?
Well, it benefits in terms of we will not have to deal with a lot of premature babies. We won't have to deal with infant mortality, which all that is caused. We'll have a healthier community, exercising more, preventing all these chronic conditions that as you get older you develop, obesity, heart disease, all those.
It's going to be better for everybody.
Yes.
Well, we're just about out of time, so tell me, is there a website or someplace that people can go to apply for benefits or to get more information?
They can actually call us at 336-703-3336, and we'll be glad to help them.
All right. Thanks for all the help you're giving folks and helping the community. Appreciate it and hope you'll come back sometime.
Thank you, Jim. Appreciate it.
We'll be right back after this.
This is what too much sounds like. This is what stress feels like. And this is what help feels like. If you've lost a job, worry about your next meal, or have trouble making it through the day, we can help. Text STRESS to 211211 to find a solution.
Back now on Forsyth County Connections. So glad you stayed with us for the program. We have a lot more in store for you. Right now, what we're going to do is talk about sustainability. And we're going to find out about that with our very special guest. Madhu Sabnis is Senior Environmental Specialist from the Forsyth County Office of Environmental Assistance and Protection. Welcome to the program.
Thank you.
Tell me something about your education, where you're from, and what led you to this field.
My name is Madhu Sabnis, and I did my master's and PhD in environmental science from University of Texas at Arlington. I have 8 years of professional experience in environmental industry.
And originally from India.
I am originally from India.
Right.
Yeah. But I have been living here like almost 16 years.
Wow. Yeah. Well, we're so glad you're here.
Yeah, I came in 2006. Yeah.
Yeah, but people don't know, off camera, we were getting ready to tape the segment. Madhu was saying great things about Forsyth County. We should have been rolling tape on that, doing a commercial about it, because you really were attracted to the county because you wanted to make a difference, right?
Yes, sure. Yep.
Let's talk about the kinds of environmental assistance and protection that your office is involved in. Give me an example. What does your office do?
So my primary job responsibility is to help and facilitate to improve sustainability. And we are working to utilize more green and renewable source of energy here. So we are working with the general services and other department to find opportunity for improving energy efficiency and planning and implementing LED lighting high efficiency projects,
right.
Solar panel projects, and electrification of transportation for zero emission vehicles.
Right. When you talk about, and you sent me an email, when you're talking about sustainability, what does sustainability mean for us folks? What does that mean?
So sustainability is a word come from the word sustain, which means to provide support or to preserve something. So we can see sustainability as an approach in life, which leads least harm to the living organism or natural world.
All right. And I asked you earlier about what your office is engaged in, but let's turn that around from a personal standpoint. What can folks like me do to help us become more sustainable in the environment?
So we can just follow simple things in our daily lives, like recycle and reuse, drive less, save energy, don't waste food, donate unused items, and use eco-friendly products.
Right.
Like that, yeah.
What is your office doing to try to prevent pollution or reduce pollution itself?
So we are working, right now we are working for the electrification of transportation for zero emission vehicles. So, and we are also working on the air quality, so it's a different department, so they are doing different things. for reducing air pollution
Right.
throughout the county.
I can tell you like what you're doing, and I know that you're making a big difference here, and I appreciate all you're doing. I wanted to ask you one other thing. Is there a particular website or phone number or anything people could go to if they see this on TV and they say, I'd like to learn more about sustainability, or I'd like to learn more about what your office is doing? Is there a website?
Yeah, so you can call us, the Office of Environmental Assistance and Protection. Our number is 336-703-2440, or you can also go online, and the website is forsyth.cc/EAP.
Okay. Well, I think that's great. Thanks for all you're doing.
Thank you.
All right.
It's my pleasure.
We'll be right back after this.
Every year, 4.5 million young adults between the ages of 18 and 24 visit the ER.
It's every parent's nightmare.
Umergency gives you all the tools you need to quickly and effectively manage your family's emergency. Umergency provides instant access to vital resources, customized to your student's campus and local community, digital consent form, and built-in urgent alert button. Umergency gives you peace of mind when you need it most. Download your Umergency app now.
So, I keep hearing how things are getting back to normal. Really? When am I back to normal? Is this normal? Was this ever normal? Then I figured out. So much has changed. No wonder nothing feels normal. But here I am, still standing. A brand new edition of me. For some great tips on finding your new normal, visit yourlifeyourvoice.org. You look familiar.
Performing on stage takes mental and physical preparation. But one thing I never thought to prepare for was cervical cancer. 91% of cervical cancers are caused by the human papillomavirus, or HPV. For many people, HPV hides inside them and they never develop symptoms. But for others, HPV links directly to cancer. My cancer almost ended my career. It almost ended me. The good news is there are vaccines that can protect you or your children from cancer. The HPV vaccine is recommended for 11 to 12-year-olds, and a catch-up vaccine may be an option for teens and young adults. Talk to your doctors. You don't want HPV hiding inside your body like HPV has been hiding inside this commercial. Did you see all of them? Go to thinkaboutthelink.org to look again and learn more. Together, we can stop cancer before it starts.
Back now on Forsyth County Connections. Glad you stayed with us. And, I was really excited to meet this lady because we all know about parks and recreation and shelters and places we want to, rent and reserve for our events. And she knows all about this. Phoua Martin is Office Administrator for Forsyth County Parks and Recreation Department. Welcome to the show.
Welcome. Thank you.
How do I go about renting one of the county's shelters? Just tell me. How does that work?
So it's several different ways you can rent our shelter. You can call us over the phone, and once we get your information, we'll log it into our reservation system, and then we'll send you the paperwork. And then once you sign that paperwork and pay us, then you're all set.
So there is a fee.
It is. It's different fees for different parks. So our community parks, which doesn't include Tanglewood or Triad.
Right.
It's $85 for the week for the shelter.
Okay.
And then $100 on the weekend. And the weekends includes Friday, Saturday, and Sundays.
I got you. Now, something you and I were talking about off camera, and I want to ask you now. A lot of times we think, hey, I'm going to have a big event with my group or my family or my school, and we'll call up and we're going to get permission. And then we don't say anything to you. We just show up with all sorts of stuff and special grills and play, bouncing things and things brought in for the kids. But we shouldn't just do that, right?
Absolutely not. You have to reserve because somebody else could have that shelter. And once you get there and they're there, then you're not able to have that shelter. Because how we do it, once you reserve our shelter, that person has that shelter from the time the shelter starts. So 9 a.m. to the time the shelter closes.
But you can't just, what I'm saying though, is you can't just, even if you get all that straight, I can't just bring in anything I want to bring in, right?
No, sir. With bounce house, you have to have vendor information. You have to have certificate of liability, general liability, because anything can happen on our grounds. So it's a lot of paperwork and things that goes along with that.
Yeah, like those bounce houses you were talking about. It's almost like when people set them up with fairs, you know, and circuses and stuff. But that's a big thing. And what about alcoholic drinks and things like that, beer and?
So no alcohol at our shelters. With special events, you know, it's a different story. And indoor facilities such as Woodland Hall, we do allow beer and wine and champagne, but you have to have a vendor registration, sign an alcohol harmless form, and things like that. Yeah.
Is it a different process for me to, in my group, let's say, to reserve or rent an outdoor shelter versus an indoor shelter?
So you would do it the same way, but with our indoor, it's a little different process. We have to have, with our reservation shelters, it has to be like a 2-week time frame. But our indoors takes more time because it's more logistics that goes with it, because we have to get in touch with more different people, security, janitorial service, different things like that to get it set up. We have to have additional paperwork turned into us, vendor information, certificate of liability, and things like that. So it's a little different. Not too much of a difference, but it is a little different.
But if I just want to have a picnic and go out there, it's a lot simpler and it's not as expensive, and just go out to an outdoor shelter.
Correct.
Now remind me again, give me an example. You said $85 for
$85 for our community parks, and that might include Horizons, Joni Moser's, Walkertown Union Cross. Triad is a little different. Triad has 4 different shelters.
Right.
Those shelters can range from 180, 120, and yeah, so Triad is a little bit more expensive than.
And just so I'm clear on this, if I'm reserving something and I fill out the form and do everything you tell me, we have to pay up front, is that right?
So you have 2 weeks from the time frame that you book. So say if you book today,
okay,
your payment will be due 2 weeks from today.
Okay.
We give schools a little leeway because they have to get it through their financial system.
Right,
so
right.
We give them a little longer than 2 weeks, maybe 3 or 4.
I'm old, I want some leeway.
Yeah, no.
All right, now how can people get more information? Is there a website or something other than just a general county?
Sure, you can Google Forsyth County Parks or Forsyth County, just the website in general, and look for our department. Or you can give us a call. We can be reached at 336-703-2500, and we can answer any questions that you may have.
All right, that's great. Well, I appreciate you doing this. You taught me a lot about this, and people should just go out there and have fun. It'll be great, won't it?
Yes, it will.
I also want to make just some closing remarks since we were mentioning websites. You know, we have this up on screen behind us all the time, connectwith.forsythcountync.gov. That's something you can go to for some general information. And I do appreciate you staying with us throughout the whole half hour, and hope you will continue to watch Forsyth County Connections. I'm Jim Longworth. We'll see you next time.